Hi everyone, this is Nikki from Happily Lost. Today we'll be looking at pregnancy and being gender diverse. This has more to do with trans men than trans women. However, for completeness, I will briefly comment on trans women. In short, there is very limited definitive knowledge and specialist guidance on pregnancy, gender diverse medical treatment, and the impact on reproduction. So, before we get into this, please press the subscribe button and bell to be notified of any updates. Give this a thumbs up if you like, or a thumbs down, and leave a comment down below. Don't forget my Facebook, Instagram, website and merchandise site. I also have a Patreon if you would like to support this and other content. So let us get into it right after this. Okay, I'm going to talk about trans women first. That is pretty clear cut. If you are at the start and have not started hormones yet, and you would like to have children who are genetically yours, then collect and store your sperm. There are agencies out there who will do it for a fee. At the moment, there is no way that you can get pregnant. After hormones, your testes will shrink and waste away over time. Later, if you decide to collect and store your sperm, you may need to get a testosterone injection into your testes to restart sperm production. During this time, you will not be able to take estrogens or cross-gender hormones. It is that clear cut. I'm sorry. Despite desiring to have children myself, I did not do any of this. I was not informed of any of this when I started. Seeing I'm now post-genital surgery, I do not have those options anymore. I do not regret my decision. So now onto trans men. The short answer is if you still have a uterus and ovaries, you still can get pregnant. Even if you are on testosterone, there is a reduced chance, but still it is possible. So if you do not want to get pregnant and you are having intercourse with a male, you still need to use a condom, which is just good practice anyway to avoid STIs. So why not just use one? For trans men, research indicates that pregnancy can be a liberating experience for some or a very isolating experience for others. Research also suggested that for some trans men, the way they cope with being pregnant and get the support they need, for some, they try passing as a cisgender woman. They could go stealth in regards to their pregnancy, or they could just be out and visible about being pregnant and being a trans man. It's entirely up to you how you go about it. No one can tell you what is right and what is not right. This is your life and you can live it how you see it. What is important is that you feel validated and get the health care that you need to get through your pregnancy. To aid in reproduction, some trans men will socially transition but defer testosterone until they have given birth. Others will stop testosterone and then resume after birth. If you stop testosterone, you can get pregnant before the resumption of your period. Typically, your period will resume within 6 months. There is no definitive knowledge regarding long-term effects of testosterone on fertility for trans men. As I said before, if you have a uterus and ovaries, you can get pregnant, even if you have had genital surgery. So if you have had metoidoplasty or phalloplasty, it is possible to get pregnant as long as you have not had a hysterectomy. If you have had chest surgery, you may be able to still chest feed if you want, but it is dependent on the surgery and your hormones. Research has suggested that some people produce sufficient milk to feed their child. Others had swelling but did not lactate, and still others had no swelling or lactation. Bear in mind, after birth, if you intend to chest feed your baby, You may not be able to resume or start testosterone until you have finished chest feeding, as it is likely to be passed on through the milk. Now, for professionals, please keep in mind that just because a trans man wishes to be pregnant and give birth, this does not negate their gender identity at all. So use the correct pronouns and name. Check in with them what name and pronoun to use. Don't just ignore it, use it. Do not make this situation or them an oddity. It is hard enough for them to be in a space where they may not feel welcome, as these spaces are geared up for women. Please, please be respectful of them and make them feel comfortable. And remember, they are not here to teach you. That is your job, to learn what you need to know. These health professions do not have trans men in mind when it comes to all the services that they offer pregnant women and postnatal care. For example, postpartum depression. And please, please do not confuse gender identity with sexual orientation. So if you like this content and would like to see more on motorcycles, art and sex related stuff, don't forget to subscribe and press the bell to be notified of any updates. Give it a thumbs up or a thumbs down if you like, and leave a comment down below. There is also my Facebook, Instagram, website and merchandise site, so check them out. And if you can spare a little money, you can support this content and other content on my Patreon page. Links are in the description down below. So until next time, bye.